There's still a little bit of whiplash over last week's sudden change in leadership at the State Department of Health and Human Services.
Elizabeth Hertel now taking the spot that had been held by Robert Gordon, meaning the vaccine program is now her full-time mission. Governor says the state corrected its early stumbles and now stands at 7th in the nation for vaccines given out. But Hertel told me tonight, keeping up the pace means a better and more reliable supply chain from the federal government.
Our real challenge, the real barrier right now is the number of vaccines that we have actually coming into the state. We have a lot of the infrastructure, the providers to be able to do the vaccine administration all over the state. And so we just continue to wait to see more coming in.
Among those eligible for vaccines, there's some understandable confusion over jurisdiction. For example, you might go to your county health department website, get redirected to your health care provider's MyChart site, sign up for a vaccine time there, and then find you're being sent to a different county for the shot.
Is there a way for us to streamline this rather than everybody having all these disparate parts that they've got to try to figure out?
Yeah, that's a great question. So we've been working actively with both the local health departments and the hospital systems across the state to bring them together for that sort of coordination between the health systems and the local health departments.
The early admonition that it could be August before many Michiganders get their vaccine was a cold water moment for many. Hertel hopes the goal of 50,000 vaccines a day can be realized and move up that timetable.
If the number of vaccines coming into the state of Michigan remains static, I think that's a possibility. But I have a lot of faith in the new administration at the federal level to be able to deploy significantly more vaccines.
As for the policies regarding schools and sports and restaurants, the new director says they all remain fluid, and she hopes that conditions and data will allow for more restrictions being lifted in the near future.